Good morning, everybody. My name's Andrew. I'm your host this morning. I'm head of HR and employment law at THSP, and this is another one of our weekly sessions of Toolbox Talks on informative and very current subjects that managers, business owners, supervisors are all facing in the workplace at this current time. I'm going to run through this Toolbox Talk. Why do we call it a Toolbox Talk? Well, it's a very easy way to communicate policies and procedures and expectations across your business. You've probably done it for years in your business for health and safety reasons, so why not use it for pertinent topical HR matters? And today, a very relevant, topical and safety critical matter is drugs and alcohol and substance misuse in the workplace. So when I finish this, which will take 12 to 15 minutes, as a Toolbox Talk should, I'll open up for any questions, and then my colleagues will send out to you the Toolbox Talk and a couple of other additional references and useful elements that I'm going to talk through on this Toolbox Talk. So without further ado, drugs and alcohol and substance misuse in the workplace is a very serious matter. Drug and alcohol misusers are nearly 4 times more likely to be involved in workplace accidents, are 3 times more likely to be absent from work for 7 days or more, and at least 25% less effective overall. And that comes from NHS England, medical advice and research from the CIPD. So it's very evident that the impact of drugs and alcohol can have a wide-ranging consequence, from health and safety of themselves and others that are in the vicinity of them, through to productivity and attendance and mental health and well-being of the individual concerned. Drug and alcohol misuse poses a threat to the individual in terms of their immediate health, safety and welfare, to the individual's future in terms of their long-term health and future livelihood and earning potential. Think about somebody who is relying upon having a license to do their job, a driver, a plant operator, for instance. Then if they lose that because of a criminal prosecution, then their livelihood is severely at risk. They'd have to think about really changing their career. And equally, the safety of those around them, and when at home and at work and around the general public, either through deliberate or unintentional acts. At THSP, drug, alcohol, substance misuse is one of the most common cases that we deal with. Probably 20 to 25% of our cases result from identified or suspected drug, alcohol, substance misuse. So it is a very common thing. Pressure is on employers to make sure they've got systems in place, testing and a policy as to how to deal with suspected drug, alcohol, substance misuse. The use of such substances can cause drowsiness, trembling, lack of concentration, slow reaction times, distorted vision, poor decision making, and reduced awareness. And of course, in many places, such as the public highway, it's also illegal. Key points to remember: you must not be under the influence of alcohol or drugs whilst at work, and particularly if operating machinery, equipment, vehicle, or plant. It's imperative that we do not cover and hide the fact if we suspect a colleague or a worker whom we think is under the influence of alcohol or drugs. This includes providing excuses for them, covering for poor productivity or mistakes they have made. You're not helping them by covering for them, and you're putting yourself and other workers at risk by failing to report their behaviour. It doesn't always mean that somebody is going to lose their job because of an identified use of drugs and alcohol. They may have a dependency, an addiction that they need help with, and it's important that we recognise that at work. Operatives must be aware that they must never operate machinery, equipment, or tools if they've consumed alcohol, drugs, or may still have alcohol or drugs in their system from the night or the day before. More and more workplaces and construction sites are conducting random drug and alcohol tests, which must be participated in or risk losing the job. Some facts about alcohol. Do not drink whilst at or before working because it stays in your system. Do not cover for any colleagues or workers whom you know are or suspect to be under the influence of alcohol. Do not drink heavy the night before and expect to work safely on site the next day, particularly if you are in control of plant equipment and machinery. Could still be over the limit when you drive to work. On average, it takes the body 1 hour of completely elimination of 1 unit of alcohol. If you think a medium glass of wine is 2.5 units, a pint of medium strength alcohol is 2 units. So you're thinking that between 2 and 2.4 units. If somebody drinks 4 pints of beer in one evening, then they'll need approximately 10 hours before they are clear for driving or operating plant and equipment the next day. For instance, if they were to finish drinking 4 pints of beer at 10 p.m., they would not be safe to operate this plant and machinery or to drive legally until 8 a.m. the next morning. Bear this in mind if you're having to leave work, say at 6 a.m. in the morning. Think about the impact of that alcohol in your system. If somebody's found to be intoxicated with drink, they will not be allowed into work or onto construction sites, and they are likely to be disciplined and may be at risk of losing their job. At no time should anyone bring alcohol into the workplace for any reason. Excuses such as, I bought it at lunchtime for consumption tonight, or it's a gift, are generally not accepted. In terms of drugs, the premise of this is do not take illegal or illicit drugs. Do not cover for any colleagues or workers whom you know to be suspect to be taking drugs. Signs to look for include watery eyes, pinpoint or diluted pupils, runny nose, constant sniffing, tight lips, sores, ulcers, trembling, fatigue, and irritability. If you see it, report it. Some employees are going to be under prescribed medication, and drugs prescribed by the doctor or bought over the counter can also make an employee unfit for work. Before undertaking that work, and if they've got this prescribed or heavy medication, they must report it to their line manager. An assessment must be made whether they are fit to take the medication and work at the same time. Some medications, when it comes to testing, do contain the same compound as cocaine, and it can flag up on a generic test, drug test, that there is a cocaine trace found in the system. The defense of the employee may be to say, I'm on codeine or cocodamol or something similar, and therefore a further test or a further investigation should be undertaken to make sure that they are not being blamed for something that is actually legitimate and fine to do, other than they didn't report it and make their line manager aware. Equally, the use of CBD oil for people with medical conditions, such as ME or anxiety. People are using high street bought CBD oil. CBD oil is not permitted or prescribed by the NHS for one very good reason, that it still contains a chemical compound called TCH. TCH is the inherent ingredient in marijuana. Therefore, when undertaking a random drug test, that could flag up that marijuana or TCH is found in the sample, in the test. Again, it's imperative that a further test and an investigation is undertaken before we get to a point of disciplinary action for potential breaches of drug and alcohol policies. But the fact of the matter is that drug misuse of any kind is likely to result in disciplinary action, and the employee may lose their job. Remember that any abuse of drugs or alcohol could result in causing harm or injury to another person. I'm just sharing on the screen now a process that is useful, a useful aid for anybody who is implementing a drug and alcohol policy, particularly testing. Once the test is underdone, we are going to get one result. It's either passed and no further action is taken, but a record of that test is made and kept on file. The employee is made aware of that. It's a data protection matter. Or it fails. It fails with an identified substance trace, either alcohol, drugs, or other illicit substances. Now, the first tests that people use and organizations use are usually quite crude, and it's a pass or a fail. There is no distinction of traceable content or parts per milligram within that person's system. It equally can mask over some things that might be permitted, like prescribed medication or CBD oil, for instance. So it's really important that this is investigated and perhaps a secondary laboratory analytical test is undertaken to ensure that the evidence is absolutely factual and right. On occasions, though, we do see employees put their hand up and admit to the use of drugs or heavy use of alcohol whilst at work. The risks to the employee are different. If the person works in a high risk capacity, then I think it's reasonable to say that acknowledged and accepted use of drugs and alcohol, usually without remorse, could result in the dismissal of that individual immediately, summary dismissal. But if they are remorseful and admit to an addiction to a substance or alcohol, then an employer has a duty of care. This has been defined in case law. An employer has a duty of care to support that individual and perhaps give them a chance, but it's a conditional final warning, perhaps with some very regular testing, some training, and a commitment from the employee that they are going to seek some help and support from their GP or some of the charities that are available. But somebody in a low risk role might be different. If they've tested positive for alcohol because they had a particularly heavy night the night before, they might have been at an award ceremony. We might think of that in a lower risk capacity. Yes, they've got to get to work. They've got to get to work safely. They may have driven to work, but they may have used public transport or got a lift or walked or cycled to work. We take this all into consideration. So somebody in the office who's failed the test, again, we've got to put this into perspective and look at what is reasonable in terms of further sanctions if we're going to take any. That for me concludes the talk on drug and alcohol and substance misuse. As I said at the outset, we are going to send through these resources. The Toolbox Talk, this flowchart that I've just talked about, which clearly demonstrates to everybody what they can expect if they fail a drug or alcohol test. And we've got our drug and alcohol policy that our clients have within their staff handbook. Can I ask if there are any questions? Please use the hands up in the top bar. It says raise and there's a handprint, or put any comments in the Q&A or the chat functions. While you were all thinking about that, just some questions to reaffirm what that Toolbox Talk has just told us. Think about this yourself. What effect can alcohol have on somebody? What could be the result of being under the influence of alcohol or drugs while at work? And how long does it take an average pint of beer to get out of somebody's system? Does anybody have any questions? I'm going to hang around on this call now. Nothing is coming through. So if anybody has any questions, otherwise we're going to stop this recording and all the resources will be made available to you. Thanks for attending today.